More than 3 decades ago, the biotechnology revolution began to sweep through science and medicine. It brought with it new paradigms and new treatments. Small companies with a pioneering spirit and groundbreaking ideas led to the sequencing of DNA, the synthesizing of new drugs, and unlocking the molecular secrets of the human body. Since its founding in 1981, Genzyme has focused on a single goal: providing better solutions for patients struggling with the most difficult-to-treat medical conditions. These patients, all over the world, are no longer isolated. They share more than a common affliction. Together, we share a spirit of hope.
Genzyme's a healthcare company. We're in the business of making people better. I mean, it's the most simple way of thinking about it. Now, we focus in certain areas. We focus in rare diseases. Has been the foundation of Genzyme, and that's where we were built. But the essence of Genzyme is we're in the business of taking care of people.
When I came here, it was really a fresh moment, and that's what I was looking for. The company was private, and it was located in the most romantic of neighborhoods, right in the combat zone, which was kind of the red light district. But importantly, it had no dedicated direction yet. It wasn't committed, and that gave us the freedom to think through what we could do.
This small but dedicated group of scientists persevered, collaborating with some of the most prominent academic institutions. The Genzyme team grew, determined to provide hope to patients with these rare diseases.
This little company was helping the NIH with an enzyme for a disease called Gaucher disease. And this was a very rare disorder, but it was very, very serious.
When we first started developing that drug, we thought there was only a few hundred patients, and subsequently came to learn that there were many 5,000, 10,000 patients that might need treatment. But the reality is, even 5,000 to 10,000 is an extremely small number of patients, and by virtue of being so small, you get to know patients.
Now, the first patient that we treated was Brian Byrne, and he looked like he had swallowed a basketball. He had a big belly. His mother said, "Give my kid a chance."
Everybody cared very much for me, and he cared very much for me, and they were very kind. And now you look back and you realize the incredible hurdle that the folks at Genzyme and the folks at NIH were trying to get over. It's pretty awesome.
We actually made an enormous difference for this child. And out of it came something very important for me that later translated into something very important for Genzyme.
I know I try to pass down to my kids that they have to appreciate every moment, A, of their health, and B, of all the blessings that we've had, and Genzyme's been a big part of that.
Inspired by the success of this small clinical trial, Genzyme sought to create new therapies no one could have imagined, and to deliver them to patients no one knew how to help.
Milestones were created both in successes and in the learning that comes from something that did not work. These weren't failures. These were experiences on which we built the next set of experiments. Merging with integrated genetics became a milestone by itself, and that doubled our ability to work in this field.
From that point, we pursued a number of similar diseases, other rare diseases, and the impact in each one of those diseases, of course, has been quite meaningful as well. So over those 10 years, 1990 through 2000, we worked on a series of enzyme replacement therapies. And we also began to think about what it meant to diversify as a healthcare company. So not just staying strictly in the area of rare diseases, but increasingly being focused on true unmet medical needs. And of course, we did it in the Genzyme way, which was very much focused on patient outcomes. In general, the opportunities in healthcare are just enormous. I mean, the needs don't change, they just increase. I mean, people are always going to get sick. The number of diseases out there without therapies is enormous. And I see Genzyme in a leadership position trying to address, many of those unmet medical needs.
In 2011, Genzyme became a wholly owned subsidiary of Sanofi, with a more specific focus on rare diseases and multiple sclerosis. Both organizations share a history of innovation and a common commitment to improving the lives of patients.
So I fully expect us to grow as Genzyme, within Sanofi. And I think the merge of our two cultures, which is, we came to an appreciation of the importance of patient care through what we learned working with very small diseases and individuals. They have come with a much stronger history and a richer history around what it means to work with large populations. And as a Genzyme company within Sanofi, we're incredibly excited about potential transformative therapies we may be able to bring forward for the multiple sclerosis community. We plan to enter that focused on only one thing, which is trying to ensure that every MS patient can get the best possible outcome.
I was diagnosed in 2004. And it makes you scared because you don't know when it's going to hit you. But I hope that it's going to stay like this for a long time, that this treatment is going to stabilize it. There will be some relapses, but if they stay that minor, I have a second chance to life. Now I have to make the most out of it.
The people who work at Genzyme self-select. There's a very simple characteristic of people who work here is that they care. And they work here because they think they're making a difference, that this is an organization with a purpose. They understand the mission, they understand that they are connected in a very meaningful way with somebody's ability to get a potentially life-saving therapy.
It is pure good fortune to have gone through the experience of Genzyme, gone through the experience that you can bring people together, that can really allow each other to be motivated in a way to do impossible things.
The patient care equation is partly about providing the best possible treatment, and it's also partly about giving that patient the sense that somebody's walking that path with them. If we have the right solution today, that's great. If we don't, we're going to work to find it, but Genzyme has been a source of hope for patients.
We often talk about hope. We talk about the spirit of hope, the motivation that hope provides. Hope can't be an empty feeling. It can't be something that's inappropriate. And I think today, the science, the technology, the capabilities, the ability of society to bring together the kind of skills that we have to create solutions makes hope an appropriate condition. And we today, I think, can be very hopeful that indeed we can come up with increasingly more important breakthroughs.